Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of the show. All of your questions are important to us, and we want to answer as many as we can for you, and so we'll get to them. Sioux Falls, caller in a stressful situation. She knows someone is mentally ill but is raising a child. Her illness is affecting the baby's development. Caller has contacted Child Protective Services. What else can she do to protect the child? Ooh.
That's a tough one.
Wow.
So you've done the normal route. The other thing I could tell you is, much like we would do perhaps with an addiction, is to create an intervention, and that is typically to get people that are important to that individual get together, make sure there's a common agreement on that. And
Close friends and family.
Yep, and if you can include a mental health professional, maybe someone from the mental health center, and sit down with that person. The purpose of an intervention is to present them with facts and try to get them to agree that they need treatment and need to seek help.
Who would help this person? What contact person would you just call a behaviorist?
Well, I don't know if the person she's talking about has had some treatment, but just not enough. That would be the first place I would go if she is connected to any kind of mental health facility or caregiver.
Okay.
Otherwise, you know, the mental health center, Southeastern Behavioral Health, or you know, you could call the Avera assessment. They're not going to necessarily have someone that's going to be able to perform an intervention with you.
There are psychologists around town, though, too.
Yeah, there are. There's you can look in the phone book, and there's a number of them. But there's very few that will come out and do an intervention with you. So I would kind of gather your resources, people that are close to you and that patient, and see if you can create that intervention.
Often an inexpensive route is pastoral services.
Yep. All right. And social services should be able to help them. Yes? Social services.
With the child, to some degree, right. Yeah.
Okay. And they've done that child protection stuff already.
Right.
Here's from Sioux Falls. Discuss the relationship between anger management and stress. Ooh, that's a good one.
Well, obviously, the more stress that you have, and especially if you're burned out, you fly off the handle. You just lose control often, and so there's a definite one-to-one relationship there. And so part of it is if you're experiencing those symptoms, you need to address the burnout, and that'll reduce the anger and help with anger management.
Yeah, I think, and I think anger management is to presume that you treat it like it's depression.
Mm-hmm. That's definitely one approach. There are a few. If this is Sioux Falls, I think there is one anger management program again at the behavioral health, or the mental health center.
Alcohol is often involved, isn't it?
Often, yeah, and that's the trick. And I think Dad was alluding to it, as were you. What is the underlying issue, if any? Now there are rarely just personality disordered individuals that use rage and anger to control people. So there are.
They let that rage go.
Yeah. So again, it's to try to establish, and you may again need the help of a mental health professional. What drives the anger?
My question is, how about marijuana abuse? Are those an angry group compared to the alcohol group?
Typically not. You know, studies on marijuana indicate that it's anything but a harmless drug. That's what bothers me about what's the Colorado law. But you know, it more typically leads to the opposite, actually, passivity, lack of intent and follow through in activity.
Belfouche, 83-year-old man, is having back surgery soon. He's afraid this is the end of his life as he knows it, and possibly the end of his happiness. How can he prepare for this?
Well, my advice would be for him to understand that back surgery is an extremely low risk for any serious long-term kind of problem. The majority are extremely successful. And so if you look at those statistics, I mean, that in itself will help you be reassuring for him.
And fear is a bad thing many times. I mean, don't you think that really you're less able to avoid danger when you're full of fear? And really, fear was meant to teach us that there's something dangerous and help us avoid it, but oftentimes it brings it right into the jaws of the lion.
Well, yeah, exactly. It shuts down our rational thinking, our ability to problem solve. And that's the last thing you want if you're actually in a situation that requires some type of planning and action. So fear to a small degree, to a controlled degree, is a positive. It's just like any of us who have taken a test. You go in incredibly overwhelmed with fear and you blank on the test and don't do a thing. But a little bit of anxiety drives you to study a little higher, kind of piques your adrenaline, and you walk in there and you ace the thing.
The right amount.
It's the right amount.
That's a good thing.
Right. Alcester, is it important to discuss suicide? Now, this is the last question, and I want to just read that question. Discuss suicide in a straightforward manner. Should family ask a suicide member to promise not to self-harm, and does that help? And
So to ask the question, we absolutely agree with. That is an important part of discussing where someone's at. If you have concerns, you need to ask the question. The second part about forming that contract, as we sometimes call them, really doesn't have a lot of support in research and literature. It's something that we commonly do, but whether or not it's actually protective, I wouldn't rely on that. So getting someone's word that they won't harm themselves,
shouldn't give you a great deal.
I wouldn't rest all my hopes on that one.
As physicians, though, when we've got somebody in the room and we're worried about it, we ask two things. Have you thought about it? And have you made any plans to do it? You know, because that puts it in a different kind of realm,
right.
That they should see some help.
Actually, and one of the things I do is to say, and here's my number. You know what I mean? Mm-hmm. If you get into that scenario, it's a bad choice. It's a terrible choice. And don't think about you. Think about somebody else than you for a minute. This is the most destructive thing you could possibly do to your family.
It is the most destructive thing, and I would urge you that if the individual does acknowledge they've had suicidal thoughts, and especially if they have a plan, because now you're moving up the severity scale, you need to get professional help. And if there is no other choice, you can actually call the police, explain the situation, and there are mental health holds where they will take the patient in for evaluation and treatment.
Forcibly do it.
Forcibly do it if that's the only way to do it.
If you have to. Sioux Falls, is depression a genetic illness?
I would say there's very strong evidence to indicate that that is a factor. I think we talked earlier in the program about the fact that most illnesses that we look at now, we recognize there is a degree of genetics, a predisposition, if you will, to specific illnesses, whether it's diabetes, whether it's depression, whether it's schizophrenia. The thing is that there is a relationship between environmental impact and that genetic predisposition. So we currently believe that for the most part there's a triggering event. Now some forms of illness are present at birth. That doesn't mean there wasn't a triggering event, it just probably occurred in the womb. But there is very clear evidence that almost all mental illnesses, including addictions, can be traced to a genetic component.
But so is diabetes, yet some people can keep the diabetes away with a regular exercise program and a diet that's appropriate. I mean, there's a way to control.
That's true.
Right.
And as we learn more and more about the human genome, I think we'll find that almost everything out there has some genetic disposition.
Of course. The difficulty is we at one time hoped it was one gene, one illness. And now we realize it's a lot of these. There's a few of those, one gene, one disease, but for the most part, they're complex relationships.
Our genes, this is just an interesting, of all the genes you look at across where we are 99.9% the same genomic makeup, and it's that 0.1% that makes us all different. That's pretty amazing.
And look at the difference. Selby, name some illnesses caused by stress or related to stress.
Well, you know, I think, Rick, there's not an illness out there that you couldn't name that causes some degree of stress.
Everything.
I would probably go this direction, though. I would say, I can remember a patient that I had, very dear patient, extremely severe rheumatoid arthritis, and just crippling arthritis, and ended up bedridden. But she was the happiest person I ever knew, because of one thing, she didn't focus on her disease. She focused on other things. And so I think regardless of what illness you have out there, they can all cause stress. Focus on something else besides else.
That's a beautiful way of putting it, Tad, because I have watched, I mean, we're all going to go through these illnesses, I mean, you know, and then we die. So what are we going to do? I have just that same patient. It must be related.
Yeah, probably.
In fact, I've got a bunch of them. And as they come down the pike, you know, they handle it. You know, it's a beautiful thing. And I think that idea of dealing with it is a wonderful thing, because life is full of tough times.
However, I will say this, we have to make sure that we don't imply that if you're stressed or depressed because you have a serious illness, that that's a weakness of character.
Yeah, it's not.
It is not.
We are all made up differently in terms of our ability, and that's shown, again, very early in life. We all have different temperaments, different predisposition for whether we're anxious or not, whether we're optimistic or pessimistic. So I agree with Tad in that, you know, so much of how we handle life is how we look at it, how we approach it. But we also have to understand that again, it's a complex situation.
Every situation's different, of course. And you know, the genetic thing about an individual is what makes them special. So maybe that person has a genetics that's a little bit depressed, but that also brings that person to be this particularly sensitive about this particular issue, or plays the piano a little bit better, or has time to do things this way, or it makes the individual. Some of that depression is what drives a person to be productive. And so I've heard that we all have a little bit of depression, and it's that little bit of depression that made us march west and find new country and develop the United States and on and on and on. Lamar's Iowa caller has depression. She barely gets over it and then falls into it again. How can she get out of this cycle? Ooh.
That is a tough one. And you know, again, I think I mentioned it earlier on the show, so many people look at depression as a flu-like illness. You have it and then you get over it. For many people, it truly is a chronic illness. It's recurring. Statistically, if you've had one episode, you have 50% chance of recurrence. If you've had two, it's 75. 3, the odds just keep going up. So there are people that unfortunately have recurrent forms of depression. There are some more aggressive ways. I really can't comment too much on that without knowing what she has already tried. We talked about, though, other forms of intervention, such as exercise, bright light therapy. Those aren't curative necessarily in themselves in a lot of these tough cases, but it's incremental improvement. If you gain 5%, 10% by focusing on some of those things, again, that you can control and work closely with your doctor on medication, you may be able to create enough of a difference to be able to manage that chronic illness.
You know, Rick, something we haven't talked about, there's a whole new area out there called pharmacogenomics. And it's about how we have our DNA, our genetic makeup, causes us to respond well to certain medications and not so well to others. And you know, as physicians, we've seen that all for years. You know, why does somebody do well on that medicine, the next person doesn't? And so too in psychiatric medications for depression. Some don't do as well as others, and so we're at a point now where we're able to actually begin to start mapping some of that stuff, and I think you'll see a lot more of that in the future.
And both of you guys have been leaders in this. I mean, you're part of this whole movement.
That's a wonderful movement, I'll tell you.
The last question, DO stands for, what is a DO? Both of you happen to be DOs. What's that question? What is a DO?
Yeah, I'm happy to answer that. It stands for Doctor of Osteopathy, and so we're osteopathic physicians. We go through medical school, the same as our MD colleagues, go through residency programs like our MD colleagues, have the same type of specialties and subspecialties as our MD colleagues do. I think the thing that separates us is a historical focus. Years ago, this goes back to the late 1800s, where our founder said, you know, there's got to be a little bit more to treating folks than just giving them a medication or pill or potion. So looked at things like manipulation that's similar to what chiropractic might do, lymphatic flow, and what we refer to as holistic way of approaching care.
Or hands-on.
Yeah.
So the concept of helping the body heal itself, along with the other things that
So, but the tradition kind of morphed into the fact that the DO schools and the MD schools are really very, very close.
Very, very similar.
Of course, the MDs are much better than the DOs. Oh, I mean, the DOs are much better than the, I mean, and I have
look at the time. 2
of the greatest doctors I know right here, and they just happen to be DOs, and they are fabulous. So great to have you here. Thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Broadcasting at our regular time, and call in or email your questions. And until next time, stay healthy out there, people.